Please take your seats. Ladies and gentlemen, distinguished guests and fellow advocates for a healthier Northeast, a very warm welcome to the Northeast India TB-Free Summit. I am Mani Sucha, and joining me today is my co-host Prasanjit Das. Together, we are honored to be your hosts for this remarkable event.
Thank you, Annie. Namaskar, Khublai, and very good morning. It's a rare pleasure to be part of this historic occasion when all concerned from all corners have assembled to offer newer vigor and stronger trust to this NTB 2025 mission. Curtains are raised, ladies and gentlemen, to discuss, develop, and disseminate strategies and tactics to counter, contain, and clear out TB from the region and the country.
Thank you, Prasanjit, for that. The theme for today's summit, Bridging Borders for a TB-Free Northeast region. Tuberculosis is an infectious disease that poses a significant threat to public health and stands as one of the primary goals and global mortality. Prior to the outbreak of COVID-19 pandemic, TB held the position of being the foremost cause of death attributable to a single infectious agent, ranking above HIV and AIDS. Achieving the objective and target of reducing TB incidence therefore necessitates for a global commitment to combat this disease. We have gathered here to make a difference and work together for a TB-free Northeast region. It is indeed a noble mission, and standing here, we feel the energy and enthusiasm already that is in this room.
We are privileged to have some distinguished personalities, renowned health experts, and representations from the communities, all determined and relentlessly working towards slowing down and ultimately warding off TB from the region. We would like to extend our heartfelt gratitude to Honorable Chief Minister of Meghalaya, Shri Conrad K Sangma sir, Honorable Health Minister Meghalaya, Honorable Principal Secretary Meghalaya, Honorable Commissioner and Secretary Health Nagaland, MDs from Meghalaya, MD Manipur, MD Arunachal, WHO representative to India, Honorable DGG CTD Government of India, and Director Negrims, who are here amongst us. We welcome you, sirs and madam.
Ladies and gentlemen, please join me in giving a resounding round of applause to our distinguished guests. As a symbol of deepest appreciation and on behalf of the Health Department, we would like to offer a small token of gratitude to all our esteemed dignitaries who, despite their demanding schedule, have taken time to be here with us today. I therefore begin by requesting our Honorable Health Minister of Meghalaya, Madam Ampareen Lyngdoh, to kindly felicitate our Honorable Chief Minister of Meghalaya, Shri Conrad K Sangma. I request our Principal Secretary, Health, Meghalaya, Sir Sampath Kumar Sir, to kindly felicitate our Honorable Health Minister, Meghalaya, Madam Ampareen Lyngdoh. I will again request our Principal Secretary Health, Meghalaya Sir Sampath Kumar, to kindly felicitate the WHO representative of India, Dr. Roderico Ofrin Sir. I'd now like to call upon our Mission Director NHM, Sir Ram Kumar Sir, to kindly felicitate the Commissioner Secretary Health of Nagaland.
I will again request Mission Director NHM Meghalaya to felicitate Mission Director NHM Government of Manipur. I will request Ram Kumar Sir to felicitate Mission Director NHM Government of Arunachal Pradesh. Would request you, Ram Kumar Sir, to felicitate Director Negrims. Lastly, I would request Director Ram Kumar Sir to felicitate Deputy Director General, CTD Government of India, Dr. Joshi. Thank you, sir. Ladies and gentlemen, I am delighted to introduce our special performance that will add a harmonious touch to our gathering. It's a welcome song that reflects the spirit of our mission towards a TB-free Northeast. This song is just not a melody, it's a message of hope and solidarity. It resonates with our commitment to breach borders and work together in our fight against tuberculosis. So, without further ado, please put your hands together and let's welcome our talented performers from the RP Chest Hospital, Shillong, who will lead us in this soulful rendition. Ladies and gentlemen, here is the welcome song.
Thank you, team, for adding that melodious and soulful touch to mark the beginning of this event. As we embark on this journey towards a TB free Northeast, we understand the importance of invoking a sense of unity, hope, and positivity. To mark this occasion, we will now proceed with the lighting of the lamp ceremony. This act serves as a beacon, not only illuminating this physical space, but also enlightening our hearts and minds today.
The lighting of the lamp signifies dispelling of darkness as we work towards eradicating the shadows of TB from our Northeast. This flame represents the light of knowledge, awareness, and determination that will guide us on this path towards a healthier and happier India. I kindly request Honorable Chief Minister Sir to come forward and initiate lighting of the lamp. I will also call upon all the dignitaries on the dais to join Honorable CM in this ceremonial lighting. A humble request to the cameraman is to just move out, make space for the audience to see.
Thank you, honorable dignitaries, for doing the honors. Let this light symbolize our shared commitment, and may it shine bright throughout Northeast India as vibrant as our culture. Let us now move forward with our program.
Over the course of today, we have an engaging program lined up, including insightful discussions, inspiring speeches, and interactive sessions. We will hear from experts in the field, and we encourage you all to actively participate in the discussions and share your valuable thoughts. The goals of this summit are to spread TB awareness to the last mile, discuss on the challenges faced, and find innovative ways to bridge the gaps and work together to make this region TB free. The major takeaway will be to create a collective vision of a healthier Northeast, promote regional cooperation, and facilitate towards the region's active contribution at the national and the global level.
To begin this summit, we are privileged to have in our midst Shri Ram Kumar Sir IAS, who serves as the Mission Director of HCM Meghalaya. Sir Ram Kumar has been a driving force behind many innovative healthcare initiatives in the state of Meghalaya, working tirelessly to improve public health and contribute to our mission of a TB-free Northeast. Sir Ram Kumar will be delivering the welcome address, setting the tone for the critical summit.
Thank you. Thank you. Due to paucity of time, thank you. I would like to take the opportunity to welcome our guest, Honorable Chief Minister of Meghalaya, Shri Conrad K Sangma, who has been our leader in terms of taking healthcare up to the doorstep level at multiple fronts. I welcome you, sir, for taking time on your very, very busy schedule. Honorable Health Minister, Dr. Ampareen Lyngdoh, Madam's presence in our department as well as the initiatives which has been taken has been really inspiring. Thank you, ma'am. Thanks for taking time. Dr. Roderico Ofrin, country representative from WHO India. Dr. Roderico's first visit to Meghalaya. I'm very happy to welcome you, Doctor. And we hope that our cooperation goes a long way. Mr. V. Kezo, Commission Secretary to Department of Health and Family Welfare, Nagaland. I'm very happy to have you, sir. Thanks a lot for coming. Dr. Samajit Nigombam, Mission Director, Manipur. Shri Marg Sora, Mission Director, Arunachal Pradesh. Professor Dr. Nalin Mehta, Director of Northeastern Regional Institute of Health and Medical Sciences. Dr. Rajendra Joshi, Deputy Director General of Central TB Division from Ministry of Health and Family Welfare, Government of India. Our Principal Secretary, Mr. Sampath Kumar, Dr. Anjali Ramchandran, National Professional Official from WHO, who has been very, very instrumental along with her team to putting this event possible. The various WHO representatives from all the northeastern states and from the countryside. The state TB officers of various states, State TB Officer of Meghalaya, Dr. Jennifer, our previous TB Officer, Dr. Maury, who was instrumental in making a lot of changes in the last 2 years. District TB Officers of various districts of Meghalaya, NHM officials, Directors of MI, MCH and Research, Press and Media. And the most importantly, today we are having stakeholders. These are all regular stakeholders. We have had today traditional healers associations who have come from all over the state. I really, really extend a very, very warm welcome to you and thank you for participating in this. Without your contribution and without your role, we will not be able to eliminate TB any future. So I'm very happy and thankful for all of you to be here. The private practitioners from various private hospitals who have been taken our invitation and have been here. The development partners from Japaigo, KHFTT, Piramal, HLL. Very, very thankful for all of you to making this possible. Sir and everyone, I would like to inform you this is the first of its kind of summit on TB which we're having in Northeast. And when WHO had approached us, we were more than happy to host in Meghalaya and be part of this entire initiative because we've been tackling TB head-on for the last 2 years. We have done various initiatives and this only was a culmination of all those efforts. This is a very, very momentous occasion in that sense and in our elimination to end TB by 2025. We hope today we'll be able to deliberate and come about with a lot of inspiration and ideas which we'll be able to practice in our states, learn from each other. Today's main session is to learn and take away from one another. That's the whole idea of the session. I am very also particularly interested on the post-lunch session where we will have all the partners space to express their ideas and concerns and how we can go about this together. Once again, I will welcome you all to this Northeast TB Summit and I wish you all a pleasant stay in Shillong during this beautiful weather. Thank you all.
Thank you, Ram Kumar sir, for your heartwarming welcome address. Your words have actually set the tone for today's summit and have inspired us to carry on our work towards TB-free Northeast. Thank you once again. It's a great delight, ladies and gentlemen, to have DGG CTD Government of India, respected Dr. Rajendra Joshi sir, amongst us today. Sir Joshi has been pivotal in the wondrous progress of the CTD from an important department to the engine of TB elimination in the country. Sir Joshi is leading the entire department in assimilating, revamping, and offering its pragmatic support countrywide. We would most humbly request sir to kindly come on the dais and share your words of wisdom.
Thank you. Namaste. Respected Sangma sir, Chief Minister of Meghalaya, Madam Lyngdoh, Honorable Health Minister, Dr. Ofrin, Dr. Sampat Kumar, Dr. Ram Kumar, Kezo sir, Mark Sora sir, Samarjit Ningmom, and Dr. Nalin Mehta, and all the experts and dignitaries who have assembled here. On behalf of Central TB Division, I extend a very warm welcome to you all to this very historical summit. The Northeast, with its diverse population, difficult terrain, and vulnerability to natural calamities, has faced unique challenges in the fight against tuberculosis. But despite these hurdles, there has been a commendable progress in the collective journey towards the TB elimination in this region. So, Northeast has been the forefront of many innovative and determined actions to combat tuberculosis. This progress is really due to relentless efforts of the political leaders, administrative leaders, and all the stakeholders, including communities in this region. I had the opportunity of witnessing firsthand yesterday when I went to different community health centers, health and wellness centers. The passion with which they work and the hygiene they have maintained, the records they have maintained up to date is really remarkable, sir. Community engagement is one of the cornerstones of our tuberculosis elimination. And today morning I had the brief interaction with Hon'ble CM sir, where I was really impressed with his understanding of our health system, tuberculosis, and how there are so many factors, social and other factors, which affect the tuberculosis. Sir, it is very remarkable that in spite of your busy schedule, you have got such a deep understanding. Your review and guidance is definitely going to make a huge difference, sir. India, we started a first of its kind community engagement program, which was launched by our Honorable President of India, Madam Murmu, called Pradhan Mantri TB Mukt Bharat Abhiyan on 9th of September 2022. And this has been world's largest crowdsourcing and supportive engagement program so far, where not only there is nutrition is addressed of the TB patients, but also the donors whom we call Nikshay Mitras. They help to reduce the stigma. They help to make the people with tuberculosis feel as part of the community. And in this we have got about 10,000 Nikshay Mitras in the Northeast region, which have come forward and doing wonderful work. I'm pleased to note that there are all the stakeholders like traditional healers, which are important part of the healthcare delivery in this area, and all the partners are here. So I extend a warm welcome to all of them. I am also pleased to highlight the invaluable contribution of the World Health Organization, which is giving a lot of technical support to Northeast area. Sir, I would like to make a heartfelt request to both political and administrative leaders who are here. Your role in reviewing the program at regular intervals is going to make a huge difference. And I am happy to note that it is already being done. So I am thankful to you, sir. So with support of all, like the welcomes all said, working together, I am sure we can eliminate tuberculosis from our country. Thank you. TB harega, desh jeetega. Namaste.
Thank you, Joshi sir, for those insightful thoughts and paving a way for us in terms of achieving our goal. I now call upon Dr. Nalin Mehta sir, Director NIGRIMS, to share his valuable thoughts.
A very good morning. Shri Conrad K Sangma, Honorable Chief Minister of Meghalaya, Dr. Ampareen Lyngdoh, Honorable Health Minister, Dr. Roderico Ofrin, WHO, Shri Sampat Kumar, Principal Secretary Health, Shri Ram Kumar, Mission Director, NHM, Meghalaya, Shri Kezo, Shri Sora and Shri Lyngdoh, Mission Directors of Nagaland, Arunachal Pradesh and Manipur respectively, Dr. Rajendra Joshi, the healthcare professionals who've gathered here, traditional healers and the doctor. Ladies and gentlemen, it gives me immense pleasure to be here amongst you today on this historic occasion, as this wonderful initiative has been taken by the state of Meghalaya, where we pledge to end tuberculosis, a scourge that has tremendous implications not just on the health, morbidity and mortality, but also on the efficiency and economy of the nation. A lot has been done by the state of Meghalaya because there has been a very big support from the political leadership to combat this scourge. And it's heartening to note that we have collected together to get rid of this scourge from the entire northeastern region. We have a few advantages as well as disadvantages. Like Dr. Joshi has said, we are probably one of the cleanest places on the planet. And that should be an advantage in this battle against tuberculosis. In addition to that, there has been a lot of synergy between various departments. And I, on behalf of the central government and as a representative of a central institution here in Nigrims in Shillong, pledged to support. We've been holding hands together with the state for just about every program that we have to cooperate in. And this is another in which we have to be wholeheartedly involved. The role of the institutions like ours cannot be undermined. But more importantly, I would like to appreciate the entire society of this state, which turns up in large numbers when it comes to cooperating in such endeavors. So I'm extremely hopeful that we will probably meet our goal ahead of the deadline. And to this effect, I would like to wish everybody the very best of success. And thank you for being here. Bless you all. God bless.
Thank you, Dr. Mehta, for enlightening deliberations. I'm sure this will offer new perspectives to our work and efforts. Let me take this privilege of introducing Shri Sampat Kumar, IS, Honorable Principal Secretary Health, Government of Meghalaya. Sir Kumar has been wearing many hats and is often known as an impactful senior officer, leading by examples and leaving inspiring footprints of change and development. Over to you, sir.
Good morning to all of you. First of all, I would like to pay my greetings and respects to our Honorable Chief Minister, who has kindly consented and also under whose guidance this first of its kind event is being organized in the Northeast. Because one thing that I think you all aware, our Honorable Prime Minister very fondly mentions that we need cooperative federalism. So this is something, a very good example of cooperative federalism initiative, because here all the northeastern states are coming together and trying to, address a very important challenge, by sharing our own experiences and also by sharing our own insights, especially Northeast is a different region altogether. It has different challenges. Not many people are aware. When you open a Google Mail, if you want to send a Gmail, it takes at least a lag of like 1 to 2 minutes compared to other places, because the mail has to come, all the way from Bay of Bengal and reaches us. So it's a lot of challenging. So not many people understand this one unless they have an opportunity to work for a quite a good enough period in Northeast. Unless you work in Northeast, it's very difficult to understand the challenges in Northeast. So with this note, I would like to thank again our Honorable Chief Minister and our Honorable Health Minister, Madam Ampareen, and I also warmly welcome, our WHO representative, our Honorable respected Dr. Roderico. He is the chief of the World Health Organization for the country. So we are very honored to have you here. And I also thank all my colleagues, who are here from representing every state. Thank you for your time, especially the Commission Secretary, Nagaland, and mission directors, coming from all other states, and also Dr. Nalin Mehta, who is a good friend of, Northeast, and also especially for us personally. And I thank Dr. Ranjini, Dr. Shanta ma'am, and all directors who are representing the states, and also the healthcare practitioners, traditional healers. So I wanted to say a few things about what for this, but as I said with a note. Northeastern region is, as I said, it's a complex. It has complex challenges. So we need a different kind of an approach in solving those challenges. I think basically one thing that what we have seen of late, if you look at it, is that there is a tremendous aspiration is there to see change in the lives of the people. So we also need to understand there is a tremendous aspiration, both at the political leadership level and also at the communities level, that we need to change the way the things are happening. So a lot of initiatives are being taken up. So I just wanted to give some examples of how actually we have been working in Meghalaya. Maybe that would actually give us some kind of a idea, how actually maybe other states also, contributing, we can also listen from them. One of the things that the state of Meghalaya has been, following is that essentially we are following a very interesting model. I think I wanted to invite our Honorable Chief Minister would share more. We are following a kind of a government, should not work the way which works its usual way. We need to be very innovative. We need to, really see that how actually we can work in a very collaborative way to solve problems rather than just implementing programs. So this is something that, very important thing is that purpose is more important than, the inputs that what we are giving. Whether, you can implement, programs, but whether the programs are actually achieving the purpose. So to achieve that purpose driven work, what actually the state of Meghalaya, what we are doing is that we are building a kind of a entire state capability through collaboration, collaboration between different departments, different agencies, and also collaboration between the state agencies and the communities. So very important. From the one on hand, there is a concept called supply side and demand side. So streamlining this entire supply side intervention through collaboration, through purpose, in fact, I would say public service motivation, because a lot of public service motivation is very important. At the same time, how actually we are mobilizing the communities, in terms of understanding and connecting them with that purpose. So through this process, actually, what we have been trying to do is that how to create transformative development. I call it transformative development because, generally we talk about incremental development, but the aspirations are different now. People are looking for transformative development. So the different kind of energy levels are required, but that energy, if you come together, you can really create that energy that can actually, cut any problem. So that's where that entire collaborative approach is important. So we have created some kind of a framework and we started working. I just want to tell you some examples of it. In fact, malaria was a major issue. In fact, at least in northeastern states and Meghalaya, we used to have the highest number of deaths due to malaria. Today, malaria has been addressed just like that, because there is a intent was there, and with the collaborative efforts with communities and and with the healthcare functional systems, we could able to do. Similarly, polio across the country, we did it. That's again a very strong intent. We wanted to eliminate. Similarly, the TB that we are talking about it. In fact, in Meghalaya, we have launched a mission called Rescue Mission, where we wanted to save every mother, every child. There should not be any IMR, MMR. We should not see the numbers. we should see there should not be, any death. So we, in fact, our Honorable Chief Minister has started a Chief Minister's Safe Motherhood Scheme. Again, using this entire collaborative approach and, providing solutions, what are required to the context of Meghalaya. Today, we brought down about 40% reduction in the maternal deaths in the last 2 years and, 2.5 years. So this is the kind of a work that is happening. That's what I wanted to say. There is a tremendous scope. Even TB also, we can do it. If we have the same kind of a vision that we can do. And there is I wanted to just one more thing that yesterday, in fact, there was a review done by our Honorable Chief Minister on housing mission. Meghalaya, now we are constructing about 150,000 houses this year, which covers about 25% of the households in the state. So 25% of the households are going to have, especially the bottom, poor, are getting the houses. And we're not looking at it as a housing project. We are seeing it's like a One Health project, because the moment you have a house, you have a ventilation, you have everything, you have sanitation. So tremendous, it will address all multi-dimensional poverty issues. So that's where, we are trying to really connect everything and, trying to implement with a purpose. And I'm sure Northeast has so much to, tell to the whole country. I think this summit definitely will give a lot of ideas to the rest of the country. And we are talking to the the Government of India officials like Additional Secretary and MD NHM, and also the Joint Secretary who is in charge of TB. So they're quite keen to see what is happening, what's going to come out of this TB summit. And I wish you all the best, all the participants, for a very, very fruitful discussion today. Thank you very much, and Kublai Shibun and Mithila.
Thank you so much, sir, for your enlightening thoughts, which are sure to infuse elements of pragmatism and enthusiasm into the already geared up work in the fight of TB. I take this immense pleasure and pride of introducing Dr. Roderico H. Ofrin, WHO representative to India, to this audience gathering. Dr. Roderico, over 2 decades of experience in public health, has been a stern advocate of health rights. Sir, we are really honored to have you with us today, and I welcome you on stage to kindly share your expert views and guide us.
Thank you very much. And as you say here, Kublai. Good morning, everyone. Honorable Chief Minister, Shri Conrad Sangma, Honorable Health Minister, Dr. Ampareen Lyngdoh, officials of the Ministry of Health, Principal Secretary, MDNHM, distinguished guests on the dais from all over the Northeast, stakeholders, partners, different advocates and champions of TB, especially my own TB team, who is also working hand in hand with all of you. Very good morning. It is really an honor and a pleasure for me to be here and invited in this TB-free summit. TB-free Northeast. It's a push for all of us to contribute to that end TB in India, TB Mukt Bharat, as it is called, by 2025, 5 years ahead of the SDG goal to end TB. We have done a lot. As you can see on the screens around you, these represent all the videos, the films of the best practices around the state, whether it is the mobile X-ray and lab sample carrying around Meghalaya. You also have the traditional healers being trained and engaged in active case finding here in Assam and Meghalaya. Integration of the national health program, integration of TB in the national health program. It's happening in Tripura. And of course, the impact of all your efforts in increasing active case finding. We have seen that the presumptive case numbers are really reaching highs all over the Northeast. So congratulations for all of that. I think it really deserves a big hand, and that's why we are having the summit, and it's something to celebrate and learn from each other. That's why we all meet together face to face. I think we have limits when we exchange information when we're doing everything virtually, but this time it's people to people, which will solve us and bring us to the end of TB. We are in our last miles, and this is what is needed. More importantly, I think the next part of my talk is that we have more to do. It's not just that we celebrate our good practices. We need to scale those up, spread it around, spread the information. It may be useful for other states across the country or even other countries. Every state has its own state plan, and we have to push towards its implementation. But more importantly, the TB Muk Panchayat plans of every state. A TB-free village will be a healthy village. And I think that will be the core of the push of where this will start. Well, where will TB start and end? A TB-free village is a healthy village, is a healthy state, it's a healthy Northeast, it's a healthy India. I know also that the estimates for TB are kind of consolidated towards a regional figure, but I think we should, when we're on our last mile, we have to find those numbers at every corner. We should have our estimates per state, per district, and we will be happy to support that kind of estimate, that kind of exercise. So we find that last TB case, find that group, the close contacts everywhere. I think one big thing strategically is to really leverage on the investments in primary healthcare. We have seen, I've just visited a health and wellness center in Riboy, and that health and wellness center was functioning as you would expect it to be in a book. In a the MHLP was so active. She knew her TB patients. They were showing me how they downloaded to the Nick Shea app, but also the idea that diseases are not mutually exclusive. A pregnant mother may have TB, may have presumptive TB. An NCD patient who is hypertensive, or maybe more so if it's a diabetic, may have TB. So looking at the patient holistically is what we can leverage further from these investments in primary healthcare, primarily through the health and wellness centers. So we have to think about that, less of TB as a vertical, but as part of a whole health service that makes the community healthy. I would say the health and wellness center is the caregiver of the community, and TB can be the lead point. If a community again is TB free, it will be an amazing contribution to the health of that person, that family, and that community. So that's one thing. It's really leveraging that. Doing opportunistic screenings. We should ask if someone is hypertensive, why don't, and a bit coughing, let's check for TB. Maybe you have a contact. We don't know. TB spreads so fast, and sometimes it's silent. Next is to leverage other ministries. When we are at the last mile of things, the solutions are probably not in the health sector. You might have already all the hospitals, the healthcare workers trained, traditional healers trained, but why is there still TB? Probably the issue is access. Probably the issue is a road. Probably the issue is in the workplace. And thus, I am very grateful that the Chief Minister is here carrying us through all these other sectors. And he has a very good understanding, not just good, very detailed understanding of what health is in my brief interaction with him, that the problems are not sometimes in the health sector. The solution will be, let's say, very simple, is water. So in a very complex disease such as TB, we should keep thinking, why, where is it? And together, I think if we have all of these perspectives together, that we have different stakeholders in this meeting, we can find solutions together. There are problems, but it's really finding these solutions. And so what's next? We should always ask ourselves, yes, this is a great summit. We are coming together. We are learning from each other. But what's next? after this summit. So I think we should have a continuing platform to exchange our best practices. We'll be happy to support that. Maybe a follow-up with our district TB officers. What would be the next action points from this summit at the district level? We have to get down to that level if we really want to get to end TB 2025. TB, the lessons of TB to other health initiatives. So it's also, we're saying we're integrating with the system, but because the whole TB program has a lot to offer in terms of innovations, of initiatives to other disease control and prevention programs. And of course, our organization, WHO, we will be very happy and be very ready to provide any technical support, operational support to any of the follow-ups that we will come out of this summit, in particular looking at that very specific data estimates, looking at other strategies, other innovations, how to scale them up, because TB cannot be the responsibility of health alone. It is a responsibility of the whole community. It's the responsibility of a whole village, the way we say it. It takes a whole village. So a healthy, a TB-free village or a TB-free panchayat is a healthy panchayat. And a healthy panchayat is a healthy state, a healthy Northeast. So I look forward to all the deliberations, and thank you again for the opportunity to collaborate with all of you. Thanks so much.
Thank you, Sir Ofrin, for the inspiring words. We are overwhelmed by your sheer wisdom of Indian and international public health affairs, and would like to carry on as suggested. There is a special message sent by the Honorable Health Minister, Government of Nagaland, Shri P. Payang Konyak. To read the message, may I call upon respected Commissioner and Secretary, Health and Family Welfare, Government of Nagaland, Shri V. Kejo, sir.
Thank you. Good morning to everybody. Honorable Chief Minister of Meghalaya, Honorable Health Minister, Meghalaya, esteemed dignitaries on the dais, and members of the medical fraternity. I am privileged to stand here, share a few thoughts, and also to convey the message of my Honorable Minister, Health and Family Welfare, Nagaland. He is engaged in voting on the polls today at the 43rd Tabi constituency, the by-poll, which is in his backyard. So he's compelled to be there, oversee the polls, and is unable to attend the function today. Before I read his message, I wish to share a few thoughts and express my sincere gratitude to the World Health Organization and also to the government of Meghalaya for providing this special platform to integrate. We have just heard our Dr. Roderico from WHO and the other officials how so many things are happening in the health sector today. We are now, a lot of credit goes to NHM for transforming the healthcare landscape in this country. So many activities are going on with so much success. And I think this is the final cap, a platform where we can integrate, pool our resources, knowledge base, and then share information, experiences, and ensure that this fight to eliminate TB goes at a faster pace, and that we achieve the goal of tuberculosis-free society by 2025. Now, we are no longer living in isolated, insulated societies. It's very interesting to note that much of the diseases we face today are actually import cases, just like COVID. And the fact that we are all healthy, clean, hygienic, and prepared, that's not necessarily insulate us or guarantee that we will not receive infections from outside. And so I wish to share this sincere thought with the health community that you will now have to, as the world changes, as the climate changes, and as we are facing new pathogens, new viruses, new infections for which we have not focused and prepared for. I think now it is important for the health community to now be more like sleuths, agents, secret agents, to gather intelligence, to engage in surveillance, to monitor the movement of people across borders, and to prepare beforehand for handling situations and eventualities that otherwise might be not visible to an ordinary person. We are just talking about now, the early speakers, about how TB can also be a silent infection. And so all this require a lot of diligence, skill, and a lot of accurate data. Now, so many things have been done. And now with the creation of this platform to share thoughts, ideas, best practices, I think the Northeast can now prepare much better to achieve this goal by 2025, if not sooner. I shall now read the message of my minister. It gives me immense pleasure to know that the government of Meghalaya, in partnership with the World Health Organization, is organizing the Northeast TB Summit 2023, aimed at achieving the collective goal of eliminating tuberculosis in the northeastern region of India by the year 2025. Tuberculosis remains one of the world's deadliest infectious killers that has catastrophic impact on families and communities. At the same time, disparities and socio-economic inequities exist that may place a heavy burden on the fight to end TB, especially the most vulnerable population. The 2030 SDG goal of ending TB by 2030 has become more ambitious with the clarion call of the Honorable Prime Minister of India to end TB by the year 2025, 5 years ahead of the fixed date. To meet this revised goal, we will need to focus on TB and mobilize more resources to accelerate the battle to eliminate TB. There is a pressing need for more collaborative effort and concerted action by all stakeholders, and to put in place a multi-sectoral framework to create an enabling environment to make the revised target achievable. The Northeast India TB-Free Summit 2023 is being held at a critical juncture. It will surely provide a great opportunity for sharing of knowledge and best practices, brainstorming innovative solutions, and fostering positive collaboration, which will help to fast-track the goal of ending TB in the Northeast states by 2025. I express my sincere regrets for inability to attend the summit due to prior commitments, especially the by-elections that is scheduled on the same day. On behalf of the state of Nagaland, I convey my sincere appreciation to the World Health Organization and the government of Meghalaya for this significant initiative. And I wish the summit a grand success and commit to the call and the efforts in accelerating the progress of ending TB in the state and in the Northeast. TB harega, desh jitega. Thank you. Jai Hind.
Thank you so much, sir, for that wonderful message. And I'm sure inclusivity is very important as we move towards comprehensive primary health care. It gives me immense pleasure now and very excited to have amidst us Dr. Ampareen Lyngdoh, our Honorable Health Minister of Meghalaya. Madam Lyngdoh has been a dynamic politician and a public leader holding diverse portfolios in Department of Labor, Information and Broadcasting, Housing, Education and Health. Starting her career as a professor, she is well known for her professional prowess and has been instrumental in speeding up various health revolutions in the state. We humbly invite Madam to impart her motivating words of encouragement to everyone present here.
Very good morning to one and all. The Honorable Chief Minister of the State of Meghalaya, Mr. Conrad K Sangma, sir, such a pleasure to have you here, guiding the department at every possible way. Very honored and delighted to meet in person Dr. Roderico H. Ofrin of the WHO, including your entire team, sir. We have communicated many times on various matters, but it is an honor to be meeting you in person here today. I want to thank our Principal Secretary, Mr. Sampath Kumar, IAS, and his commendable efforts to guide us and to take this entire department into the right direction with substantial good results, and he continues to be such a source of inspiration for all of us. I want to thank all the other dignitaries who are on the dais. For the paucity of time, wouldn't like to individually thank all of you, and look forward to this very important sharing of ideas that this kind of a conference has in any ways been organized. I will deviate from my prepared speech to share some personal experiences and hopefully set a tone at which we will take this dialogue and discussion forward. We have time and again talking about breaking off the myth of tuberculosis, and by and large, after these various years of integrated beating of stigma, we have achieved substantial sensitivity towards dealing with patients suffering from tuberculosis. And for this, we need to thank the health team in the leadership of the Director NHM, Mr. Ramkumar, Madam Lyngdoh, and the other officials who I feel need to be appreciated for the work that you constantly do. We need now to move ahead from this simplifying of the word tuberculosis. We need to provide for a robust preventive procedure, and we need to concertedly continued focus to ensure that spread of tuberculosis is something which will happen on the ground. I personally come from a very urban constituency, and let me share with you that families have been wiped out completely due to tuberculosis in my own constituency, where healthcare is just an arm distance away. But our state has taken very, very positive steps to ensure that the preventive model is operationalized. And tuberculosis is a very, very high cost effective treatment. And we are so grateful that the Honorable Chief Minister has simplified the health scheme of the state of Meghalaya, and thousands of tuberculosis patients are now sincerely recipients of a cashless tuberculosis treatment. That's very important. Causes of tuberculosis again is something which we still need to advocate. Lifestyles of individuals, without getting into details, sometimes circumstantial situations that families grow up in, the fact that we still use even cooking materials which can to a large extent compromise our children as they are born to the time that they grow up, and they are still vulnerable. And I'm happy that the Honorable Chief Minister has just embarked upon a mission to improve housing facilities for rural Meghalaya. If you come to some of our rural homes, you'll be shocked at the way that our citizens have conditioned their lungs and their other organs into this kind of a life where housing facilities, healthy living conditions is still quite a big challenge in the state of Meghalaya. Thank you so much, Honorable Chief Minister, and we hope that this again will take our citizens out of that vulnerable situation that they have been born into. The other thing about life habits, which our Honorable Chief Minister is once again addressing very, very aggressively, and that is good lifestyle habits. The various schemes, the various platforms that he has provided for screening of officials, for screening at whatever level possible through every platform of NGOs or civil society members, always making sure that we package the word screening, preventive. And today we have government departments also making sure that they inculcate healthy practices of officers coming to work on foot, taking a bicycle. So these are all very, very concerted efforts of our Honorable Chief Minister and the team of officers who are trying to present before the people of Meghalaya that if you want to change challenges in health, you need to change the way you live. So we are grateful for that as well. And this multi-pronged plan of action seems to be yielding positive results. And today we have to ensure that we need to handhold our tuberculosis patients, especially the ones with the drug resistance tuberculosis. Just a couple of days, I lost a diabetic citizen who contracted tuberculosis, and we just had to bury him a couple of days back. So it is not like it is very distant, but it is reduced to large numbers. Now we need to see what do we need to do next to contain the spread and the threats of tuberculosis in this generation, reaching to that target of the Honorable Prime Minister, who is determined to eradicate tuberculosis by 2025. It is doable, but we need to consistently get there. We are handheld by a community participation where, our citizens in the 7,000 villages across the state of Meghalaya handhold tuberculosis patients. Like I said, nutritional inputs of diet for tuberculosis patients is an important key towards ensuring that patients are healthy and can fight the disease. And our communities located in various village health centers are now going to be the next level of people who will be there to handhold and ensure that tuberculosis eradication becomes a reality in the state of Meghalaya. I would like to also indicate certain of our stakeholders who have probably done so much work and have never been recognized. And at this point, I want to thank the Red Chest Hospital. I want to thank the tuberculosis centers in our districts. I've been to so many of them. We still need to spread and intensify our presence with as far as tuberculosis is concerned. And I am sure that in the NHM interventions, like the Secretary from Nagaland just said, thankful to the NHM for this concerted focus, because states like us who are resource poor may not have the wherewithal to address the problem of tuberculosis in the state of Meghalaya. Thank you to the Honorable Chief Minister. Like I said, sounds like I'm eulogizing him, but we need to focus, because these are diseases that are threatening in our systems. And so much as COVID, which was a one-time threat, tuberculosis continues to be an underlying threat. And Honorable CM, thankful to your constant intervention. Thank you to Sir Sampath, who has, and his team, Sir Ram and the rest of them, who has constantly been focusing on this problem. And thank you to all the other stakeholders who continue to help the Department of Health, Government of Meghalaya, to achieve and be recognized at a national level by receiving several awards in the recent months. Like I said, reiterating, screening is the key to prevention of tuberculosis. And thank you, the WHO, for your constant support, which is very, very focused. Listening to the leaders speak before us, I now understand, Mr. Roderico, why the WHO has individuals like you who know what you're talking about, rather than who are just there as dignitaries representing this World Health Organization, India. And with these few observations and a commitment on behalf of my officers, we are committed, we will work hard, and we will try to achieve the slogan of the Government of India, which means TB harega, desh jitega. Thank you, Kublai Mithila.
Thanks a lot, madam, for taking the audience through your thought leadership on ensuring health and happiness in combating TB in Meghalaya, also in northeastern India. We are really infused with the right spirit and direction listening to you. Ladies and gentlemen, we thank our stars above and the brightest star here today, the most beloved people's leader, Honorable Chief Minister of the State, Shri Conrad Sangma ji. His stature as an optimistic, progressive and promising leader grows to the highest proportion. Also, along with some of the biggest and the best initiatives under his apt leadership, his far-sighted interventions on health has actually placed him in the ranks of one of the most sought-after chief ministers of all time. The summit grows more auspicious with your dynamic presence, sir, and the audience here is all eager to listen to you. May we take this opportunity of inviting you to the dais for your words of encouragement and blessing, please.
My colleague in the cabinet, Dr. Ampareen Lyngdoh, Honorable Health Minister, Government of Meghalaya, our representative of the WHO India, Dr. Roderico H. Ofrin, our Principal Secretary, Shri Sampath Kumar, Dr. Rajendra Joshi, DDG TB, Dr. Nalin Mehta, the Director of NIGRIMS, our representatives from different states of the Northeast and different stakeholders who are here today to participate in this Northeast India TB-free summit. At the very outset, I would like to welcome you all to our capital, city of Shillong into our state of Meghalaya, and for having taken your time out to come and participate in this very, very important summit that is being co-hosted by WHO, Government of Meghalaya, and other stakeholders. I have a lot to say, but I will refrain and try to be very brief. But I will start by saying that healthcare has been one of the most important priorities for my government. In the last 6 years, we have continuously engaged and continuously invested in the health sector on various fronts. And today, we have one of the highest budgets in terms of percentage, in terms of the entire country, in different states. If you compare, Meghalaya has one of the highest, if not number one, number two, in terms of the percentage that we spend out of our budget on health. And that reflects the kind of commitment and seriousness that we have. While I say that, I would like to just reflect for a few minutes on the journey that we have had in the last 6 years and how things have unfolded for us. And I take this opportunity to share it because I feel there is a lot to learn. And I hope that these are kind of best practices in one way, not just for TB, but in general for the health sector as a whole. And I think the first thing we realized, which I shared with our representatives here on the stage earlier before this program started, was that we often mistake or we often don't realize what really the problem is. And that happens in governance as a whole, but I think health, it is even more. A simple example of that would be, we often say that Meghalaya's problem is the MMR rate, the maternal mortality rate. And we don't fail to realize, and we have different programs and we try to do different things, and we don't realize that the MMR is actually the result of the problems. It's not the problem in itself. And sometimes in governance, as officers, as politicians, we need to realize that we need to be able to identify what leads to the problem. And in our endeavor to be able to provide better service, better policy making, better administration, unless we are not able to put the finger on the actual cause of the problem, we will not be able to find the right solution, the right policy, or the right steps to move forward. Hence, I would urge all of you, as officials, as organizations, as doctors, that we need to ensure that we are able to see the big picture. We need to ensure that we invest enough time in investigation. As doctors, you investigate, but even as government, as policymakers, as an administration, we need to investigate and realize what is the real cause of the problem. When it came to MMR for Meghalaya, institutional deliveries was one part, but we realized that there was a problem because high-risk mothers did not have the accessibility that they required to the medical professionals or to even an ambulance when they needed it the most. We realized that because of maybe economical engagement of mothers not being enough in society, we were seeing the gap between the birth of two children being very small, like 1 year, 1.5 years, which was very high risk for the mother. And hence, maybe the solution was not just simply the institutional deliveries, but it was economic engagement of the women in our society. And hence that led me to move very aggressively on what we had and what we do it today, a self-help group movement of women, where in the last 5 years, I had 4,500 self-help groups. But this information and this, the result or the problem that we could see encouraged me to increase the number of self-help groups today from 4,500 today in 5 years' time to 45,000 self-help groups in my state. There is one woman from every family today who is engaged in a self-help group. It's a huge milestone, and these women are today economically active. This led us to understand that we should come out with a program called Mother. A lot of people think mother is because it's a mother, but no, Mother is Meghalaya's outcome and transformation, MOT, in health, education, rural development, and social welfare. We realize that if these 4 dots are not connected, we will not be able to find a holistic solution to our MMR problem. So this is what I strongly feel that is necessary for us to be able to do, whether it's MMR or it's TB. There needs to be detailed analysis, and every state, every district is different. Remember, there is no solution that is going to work across. You have to adapt the solutions to your needs. And Northeast is very complicated. It's very diverse. We have different practices, different beliefs, different culture, different terrain. And hence, we need to realize all this and ensure that we are able to find solutions by doing detailed analysis of what is the problem. Second, I should have in fact said this before my first. It's just that I didn't prepare my speech. I just, I've got a few points here I'm speaking, so it may be just up and down. But second point which I would like to make, which should be actually the first point, is that everything starts with your mindset, your thought, and your belief and your passion. Remember, no matter how many doctors we have, no matter how many nurses we have, no matter how many ministers we have or how many officials we have, if your heart is not in the right place, if your mindset is not correct, nothing can happen. Nothing can happen. So I urge all of you, when we are taking up a mission, let us take it up with full commitment and passion. Let us take it up with a sense of purpose that we will do it, and a determination that we will do it. And I think that is key for any program of government, organization, administration, you name it. For it to succeed, it starts with your mind and your heart. So I urge all of you that while we go through this journey, I'm sure we have already been through a lot of it, and as we continue this journey, I urge all of you that work with that sincerest commitment that you can have to make things different. I was asking my DHMOs the other day, I asked the other states and the other officials that how many times do you visit the different PHCs and CHCs and see for yourself what is the problem there? Do the states have a SOP or a different format for the DHMOs to go down to every PHC once a week or one PHC once a week? Just sit down with the doctors there, talk to them, sit down with the nurses, the attendants, the patients. Just ask them, how is everything? Is everything going well? Are you getting the kind of service you like? Is there anything that we can change? And believe me, if you start doing these small things, you yourself will look at the wall and say that, oh my God, there's a crack out there, there's a leakage out there. The light is not working, the water is not clean, the place is not clean, the bed sheet is not clean. And it takes seconds for you to change it. The small low hanging fruits that can make a difference just by ensuring that you do the right thing, that your heart is in the right place, as I said, And more importantly, as I said, you start doing the things that you're supposed to do. We get so bogged down with schemes and programs and other things and meetings that ultimately we forget what we are here for. And that's sadly the problem of our system. We're becoming a government and a governance of schemes, not of purpose, not of governance, not of actually getting the result at the grassroots level. And I think that's a systematic problem. I don't want to get into all of that right now, but I think this is a good opportunity to share this thought process with you, that we need to keep reminding ourselves about this. So doctors, nurses, officials, politicians, all of us, I think the moment we start caring about what we do, I think that can make a huge difference. And especially when it comes to healthcare, I would like to urge that it's not always about providing, the medical solution to a problem. Sometimes we can't. And therefore, even if you have that human touch in what you are doing, a patient will already start feeling much better when a doctor speaks nicely to him or her. I think 50% of the problem is almost solved there when you care more and when the human touch is there. So I do urge, as medical practitioners, to all of you, I'm not a medical practitioner, but I'm just, all of you are here, is that do not forget about the human touch. Do not forget about the care part. Health care is one word, but it's two different sides of the same coin. So you need to ensure that while we are focusing on health, please do not forget the care part also. Last, I would like to just talk about what I personally believe, that healthcare and the way things are moving in the state and the country and the world as a whole is, and you guys will be, of course, much more experts in it. But the phase with which the medicine and the healthcare is moving is, so we saw a revolution, or whatever you call it, in terms of the medicines that came up in the healthcare sector. After the medicines came up, then technology came up in terms of machines, equipments, and that was a major change in the health sector. In today's world, it is technology and IT and artificial intelligence which is going to be one of the biggest game changers when it comes to the healthcare sector and many other sectors that is there. So I want to share with you that we have started a program in Meghalaya where we have taken up Ribhoi district, where our representatives have gone and visited. Is we're going to take we've started now mapping every patient, and we started maintaining the records of the patients so that the doctors have accessibility to it with a click of a button. And no matter which hospital you go to, the centralized information will allow the health official to be able to get the history of the patient immediately. So that's one part of the entire program. But what is more important is that this data that we collect is, like in many other things that's happening in the rest of the world, is going to allow us to predict things in a much more scientific way, which will then allow us to be able to realize what could be coming in the many months or years ahead, or allow us to even predict what are the reasons why this ailment is happening. Is it the water? Is it the food? Is it the habit? Is it the genetic DNA of the patient? Is it the lifestyle of the patient? So this model will then, if you want to put it across and you add software and artificial intelligence to it, will allow us to put up a predictable model. And in a large country like India, where we have 1.4 billion people, to be able to even reduce 10-15% of the people going into hospitals and needing medical attention by use of technology like this, we will be able to actually transform the health sector as a whole. And that's really the key today, and it is happening. And I would want to see that Northeast India is not left behind in that aspect. And we should start thinking, we can learn from the rest of the world and the country and see what has happened there, and not make those mistakes and not be delayed, and move forward as a region. And we can do it. We can do it. It just requires that commitment from each one of us. many months and years back, we were, when we had so many problems in healthcare, and we still have, we keep telling our team, look, we keep our eye on the ball. We keep working no matter what anybody says. We are not bothered. We know what we want to do and we are committed to it. Similarly, I would urge all our officials from all over the Northeast that we need to work together on this. Today's program for the TB free, TB Mukt Bharat is a step that is really very encouraging, I should say. I strongly feel that the Northeast region as a whole, apart from just health, I've been speaking, I am also, of course, handling the forest department and the ministry myself in my state. And I'm very keen to see that all the issues related to environment and climate change is again another area where the Northeast as a region needs to work together. There are other areas like trade where the Northeast region needs to sit down and work together. There are other issues like youth-related issues where we need the Northeast region to come together, because we may be different states, different communities, but this region has got its uniqueness where there are a lot of similarities that are there. So whether it's health, whether it's environment, climate change, whether it's youth, whether it's trade, international trade, I strongly feel we need to continue this practice and let it be hosted in different parts of the Northeast so that every state can then play an important role in particular subject. And I feel that it's important if we as a region want to move forward and make a difference and really change the way things have been for our states and for our region, and also change the perception that's been there for our region as a region that is not as proactive as, say, other parts of the country. I think there's no reason for us to be like that. There is no reason for us to keep thinking that we can't do it. And hence, this is a program and a summit which we are very keen, and we want to set specific targets, goals. Monitoring was mentioned by some of the officials who were speaking earlier. I can't remember. I think it was our representative from the World Health Organization who's mentioning. So we need to do that and ensure that we are able to move forward. And I take this opportunity once again to thank all of you and apologize for the long speech. But I thought that this was a great opportunity to share my thoughts with you. I wish this program, this summit, the very best, and more importantly, I wish the mission the very best. It does not end with this summit. This summit is only one station in the journey. I wish this journey and this mission a great success, and it will only happen, as I said, going back to my initial speech, that it'll happen if you have your mind and heart in the right place. And I urge all of you, and I hope that we will come out successful in our mission and we will show the way to the rest of the country. With these few words, I wish this program, the summit, and wish all of you the very best. May God bless each and every one of you, and may God bless the Northeast and our country, India. Kublai Shibun, Matela, and Jai Hind.
A true visionary indeed. And I'm sure the zeal and the commitment and the warmth that we have in this room now, and the excitement that we have in taking forward the TB-free initiative in Northeast is going to be much more stronger. Extreme gratitude to you, sir, for the vision that you have for the state and for the entire Northeast. Now, just resounding what sir has just mentioned and actually showcasing the work that is being put in by the state of Meghalaya, it gives me immense pleasure and pride to introduce our next segment, that is the virtual launch of the Meghalaya Portable AI-based X-ray diagnostic facility. Meghalaya has always been, and for the very lately, known for a lot of its innovation and in healthcare solutions. The Meghalaya Portable AI-based X-ray diagnostic facility is yet another remarkable initiative. It reflects the state's commitment to deliver advanced healthcare services throughout Meghalaya, putting into practice what our Honorable Chief Minister had just mentioned. This initiative is pivotal part of the active case finding activity and addressing some of the major challenges that the state is facing in terms of screening and diagnosis. It aims to enhance the TB diagnosis rate by conducting screening directly at the doorstep of the communities. What makes this initiative more exceptional is its mobility and accessibility. This is what we've been mentioning, reaching the last mile. It brings healthcare services closer to the people's home, ensuring that even the remotest village in Meghalaya is not left alone. And I welcome Sir, and it gives me again immense pleasure to call upon our Honorable Chief Minister Sir Conrad K Sangma to officially launch the Meghalaya Portable AI-based X-ray diagnostic facility. A round of applause, ladies and gentlemen. Congratulations again for another feather to the state of Meghalaya that has just been added.
Congratulations to Meghalaya and its people. Thank you for joining us today and being part of this historic event. Let's work together to ensure a brighter and healthier state. Greatest appreciation and thanks to Honorable Chief Minister Sir for blessing the launch of one of the most forward-looking and medtech solutions introduced in this part. This is sure to accelerate the presumptive testing and case findings in this part, which will go a long way in containing the TB contagion. Thanks to all the distinguished leaders and this august audience for being part of creation of this history in terms of the AI-based portable X-ray services in Meghalaya. It has been a fantastic inaugural session, precise, promising and productive. This is sure to induce the right speed and spirit for the upcoming session. May I request respected STO Meghalaya, Dr. J. Kharwanglang, to come upon the dais to deliver the vote of thanks. Ma'am.